Oromia Regional Health Bureau, Public Health Emergency Management Research and Blood Bank Service Directorate, Epidemiology and Surveillance of Cholera. Outlines, definitions, cholera, epidemiology, mode of transmission, risk factors, sign and symptom, prevention and control, surveillance, data management, exercise. Definition: diarrhea is having 3 or more loose or liquid stools per day, or as having more stools than is normal for that person. WHO. Acute diarrhea is defined as an abnormally frequent discharge of semi-solid or fluid fecal matter from the bowel lasting less than 14 days. WHO. Cholera is an acute watery diarrheal disease caused by infection of the intestine with the gram-negative bacteria Vibrio cholera, either type 01 or 0139. Types of diarrhea. Diarrhea can be categorized as acute watery diarrhea, dysentery, persistent diarrhea, rotavirus diarrhea, example Escherichia coli diarrhea, cholera, and shigellosis, amoebiasis, typhoid. Causes are mostly unknown. Common cause of diarrhea. Cause of diarrhea: bacteria, virus, parasite, others. Vibrio cholera, Shigella, Escherichia coli, Salmonella, Staphylococcus are bacteria. Virus are rotavirus, adenovirus, calicivirus, and the parasite are Escherichia, G. gamblia, Cryptosporidium, Isospora, and the others are metabolic disease, food allergy, antibiotic, irritable bowel syndrome. Epidemiology of cholera. Cholera is a diarrheal disease of the acute and enteric disease caused by gram-negative bacteria Vibrio cholera. Vibrio cholera species are divided into 2 groups: Vibrio cholera 0 group 01 and Vibrio cholera 0 group 0139. Over 100 Vibrio cholera species known, but only the Vibrio cholera species are responsible for cholera epidemics. Epidemiology of cholera. Cholera infected persons, over 80% are asymptomatic, making the diagnosis difficult. Around 80 to 90% no and some dehydration. Around 10 to 20 of cases progress to severe dehydration, shock, and disease if not treated. Case fatality rate CFR may reach up to 30 to 50% if cases are untreated in time. Can affect both children and adults. Key indicator of social development. Remains a challenge to countries where access to unsafe drinking water and poor sanitation. Infectious dose of cholera depend on individual susceptibility, acidity, immunity due to vaccination or prior infection. Breastfeeding protects infants and young children in endemic area. Reservoirs. Main reservoirs for Vibrio cholera are humans are the main reservoir. Other potential reservoirs like water, some mollusks, fish, and aquatic plants. Vibros grow easily in saline water and alkaline media and can be destroyed by gastric acid in the stomach, chlorine disinfectant solutions, boiling during at least 1 minute. Mode of transmission: fecal-oral route, entry, oral, discharge, fecal. A dose of 1 million organisms is usually needed to cause illness. Transmission is almost exclusively by contaminated water or food. Corpses of cholera patients are highly infectious, especially physical contact during funerals and food preparation. Cholera treatment centers main source of contamination if hygiene and isolation measures are poor. Transmission by contact such as touching patient is rare. Most epidemics have started from a single source and spread rapidly. Risk factors. Most epidemics have started from a single source and spread rapidly. Insufficient water supply, quality and quantity. Unsafe respiratory disposal. Inappropriate poor sanitation and hygiene practice. Environmental and seasonal factors at the end of dry season or at the beginning of rainy season. Inadequate food and safety. High population density. Camps, IDPs. Inappropriate funeral service for cholera victims. Underlying disease. Unvaccinated people. Karaa ittiin daddabaru. Udaan gara afaanii seenu fiikoo oral route. Nyaata kuduraa fi fuduraa bishaan faalameen. Hanqina qulqullina dhuunfaa yookaan qubaa. Sanitation or latrine. Safe water supply. Hygiene and hand washing. These cycles are what feces and floors, fingers, files, fields or floors, food, new host. Incubation period, usually 1 to 3 days, but can range from several hours to 5 days. Infected person, whether they are symptomatic or not, can carry and transmit virus during 1 to 4 weeks. Infected person, whether they are symptomatic or not, can carry and transmit virus during 1 to 4 weeks. A small number of individuals can remain healthy carriers for several months. Antibiotic therapy can decrease the duration of symptoms and the period of infectivity. Signs and symptoms: sudden onset of perfuse, painless watery diarrhea or raised water-like diarrhea, often accompanied by vomiting. The stool looks like a clear liquid flecked with white mucus known as raised water stool. It is usually odorless or has a mild fishy smell. Painful leg cramp, no fever. For severe cases, patient may have cramps in the stomach, arms and legs. Dehydration within 12 to 24 hours. Prevention and control. Preventing contamination of food and water, example boiling water, covering food, information, education and communication. IEC. Point of use water treatment, hand washing at critical times, food hygiene, personal hygiene, prevention of contaminated water supplies, improvement of latrine, construction and utilization, immunization. Cholera surveillance. Cholera surveillance is the ongoing systematic identification, collection, analyze and interpretation of cholera disease occurrence for the purpose of taking timely and robust action. Key factor for effective cholera surveillance: existence of a standard case definition, simple data collection tools, clear reporting procedures, analyzed plans, rapid diagnosis of suspected case and laboratory confirmation, routine feedback of surveillance data and appropriate coordination at all levels of the public health sector. Purpose of effective cholera surveillance: detect outbreak of cholera early, identify hotspot areas where outbreaks regularly occur, enhance cross-border cholera surveillance, assess the size and extent of the outbreak, determine if an outbreak is spreading and where, plan the allocation of resources, example personnel and supplies, decide whether control measures are working, plan additional epidemiologic investigation. Cholera case definition. Community suspected case definition: any person 2 years of age or more with profuse acute water diarrhea and vomiting. Standard case definition: suspected case in areas where a cholera outbreak has not yet been declared. Any persons age 2 years or older presenting with acute water diarrhea and severe dehydration or dying from acute water diarrhea. B. In area where a cholera outbreak has been declared, any person presenting with or dying from acute water diarrhea, confirmed case, suspected case in which Vibrio cholera 01 or 0139 has been confirmed. Cholera alerted 2 or more people aged greater than or 2 equals to 2 years with acute water diarrhea, AWD, and severe dehydration or dying from AWD from the same area within 1 week or one another. This from severe acute water diarrhea in person aged greater than or equals to 5 years. A case of AWD testing positive for cholera by rapid diagnostic test in an area that has not yet declared a confirmed case of cholera, including areas at risk for extension from a current outbreak. Diagnosis clinically or case definition laboratory culture RDT for surveillance purpose. Sample collection and transportation. Carry Blair transport medium. Shelf life of up to 1 year from date of manufacture. Does not require refrigerator. Must reach the laboratory within 7 days. Clean container. Use is if Blair is not available. Place the sample in a container with tight fitting leak-proof lid. Must reach the laboratory within 2 hours at room. Filter paper. Use this if Blair is not available and the specimen will not reach the laboratory within 2 hours. With filter paper for confirmation of cholera alert. A field investigation to confirm or rule out the outbreak. Stool sample collection for laboratory confirmation. Once confirmed, providing timely information, identify population at risk, guide the implementation of control and treatment measures. Approach of cholera disease surveillance. Indicator-based. Routine collection of data based on these indicators from health to posts, health centers and hospitals and laboratories are and others. Unstructured description rumors and reported about any event that can be a risk to public health. Community-based participation of the community in the detection, reporting, responding to, and the monitoring of health events in the community. Routine function pre, during, and after. Environmental surveillance. Monitoring the presence of the Vibrio cholera in specific environmental water source. Inspecting food and drink establishments. Main activity in cholera surveillance. Active case research, contact listing and tracing, house spray, potential source and risk identification, risk communication. Surveillance indicators. Completeness and timeliness of reported. In incidence rate, number of cases in 1 week over population at risk times 1,000. Case fatality rate, number of cholera deaths over number of cholera cases times 100. Attack rate, total number of cases reported over population times 100. Other laboratory indicator, water sanitation, hygiene indicators, other access and the quality of health care service. Local context information. Cholera surveillance in at-risk setting focus on enhancing prevention and preparedness activities, improving water and sanitation, strengthening social mobilization, establishing an early warning system with active surveillance, ensuring access to health facilities, and adequate case management and implementation of preventive OCP campaigns. Main challenge of cholera surveillance: lack of sensitivity, unable to early identification and response, data incompleteness, timeliness of reporting, data utilization problem at peripheral level. Yalla toma.